And so what happened is in February 2024, and we do a lot of regenerative procedures for, erectile dysfunction. And again, when it comes to size, you're a little more limited because there's been a lot of, talk around vacuum erection devices. And if you haven't seen our other video, checking that out on vacuum erection devices or penis pumps and size, but there's not a lot of studies supportive of that.
Just like with filler.
Correct. And so the medical treatments for it would be filler, which can be used fat transfers. And, there's some, again, at home type of things that men will do. And so that's more of
Which
a
sound terrible.
penis enlargement or PE type of things that they can do at home. So fillers, a medical treatment, you can do fat transfers, and you can even do silicone augmentation. And of course, there's the extreme of suspensory ligament surgery.
So surgeries
that you
where they
hear
cut.
a little bit about. I don't know that I've seen urologists actually talk about
Sounds
performing
terrible.
it. Yeah.
Look that up. Don't do it.
No, the reports are definitely not in favor of ever using that as a way to get enlargement. And again, but the manuals, like the things that they do from at home, is manuals like traction devices, suspensory devices, but vacuum erection devices seem to be the most common. And
And
again,
it sounds the least painful.
yeah, the least painful. And it's actually men, like when they talk about it, they report, maybe a 1, 2, or 3% increase with that. And again, the studies and science don't necessarily support that. But now there's an interesting study that came out in February of 2024 in the Journal of Sexual Medicine. And it was Dr. Runnels and Dr. Brandi. And again, it was a small study, but still, it was a study that talked about PRP injection into the penis. That can be known as the P shot if you're, in a group with Cellular Medicine Association and doing those and working within that, group to provide.
And then
it
this
in a
study was
standard
men
fashion.
that had no previous issues, no
No
previous
previous
treatments.
yeah.
So I think that's always important to kind of know the baseline.
And they were 30. The average age was 30. And so
So young
right,
guys.
yeah. And there was 20 to 55, average age of 30